Hi, everyone, and welcome to another episode of Let's Get Vaccinated, where each week we deliver a healthy shot of science and facts. So, we do two things on this show. Firstly, we answer your questions about vaccines and the pandemic. And secondly, we all learn how to effectively communicate science because sharing science is how we keep our communities safe. Now, if you don't know me, my name is Lucky Tran. I'm a biologist and science communicator based at Columbia University in New York, and I'm the managing director for March for Science. And today I'm joined by interim executive director at March for Science, Rania Batrice. Hi, Rania. How are you doing today?
Hi, Lucky. I'm hanging in. I'm all right. Doing okay. This is a very exciting part of my day, though, I will say, because we're being joined by our friends from Pantsuit Nation and Supermajority for a very special episode. So we want to just welcome our very special guest today, Grace Caldara from Pantsuit Nation and Supermajority. I apologize, words are hard right now. Hi, Grace.
How you doing,
Hi,
Grace?
I'm doing great. I'm so excited to be here and collaborating with you all on this episode. I am so thankful that you decided to join us in helping get the information out to our members.
Yeah, absolutely. And as Rania said, this is an exciting collaboration today, right? So maybe you could tell, there might be a lot of people from our community who are watching who might not know much about Pantsuit Nation and Supermajority. So maybe we could start by telling us, your work and what you do and what your community is all about.
Absolutely. So I am the Community Engagement Associate with the Supermajority Education Fund, and I co-manage the Facebook group Pantsuit Nation Supermajority. It's a private Facebook group. And we have over 3 million people in that group. And we're really trying to build a foundation for a more equitable and engaged democracy. And we're doing this by working to change the narrative, by using storytelling as a form of activism. And we were just Pantsuit Nation, but in 2019, we did merge with Supermajority and the Supermajority Education Fund. And it's an organization that's built around trying to build an intergenerational, multiracial movement for women's equality.
That's awesome. And yeah, Rania, maybe you could do the vice versa for those who are watching from Pantsuit Nation, explain the work that we do at March for Science.
Yeah, absolutely. Again, it's just so exciting to be here together today. And you'll see there's a lot of intersectionality here, which is very exciting. At March for Science, we have four main pillars that we focus on, and it's public health and climate and democracy and justice. And so all of our programming that you may have seen or maybe just like saw promos of it or something, it's all centered around those four pillars. And of course, all four of those pillars intersect with each other. And what Supermajority and Pantsuit Nation Supermajority do, it just intersects with all of it as well. And we often talk about the fact that these issues cannot be decoupled. We can't talk about climate without talking about justice. We can't talk about democracy without talking about justice. Same with public health. So all of these things come together in such an important and impactful way. And another thing at March for Science that we're really very kind of focused on is working together. We often talk about the fact that I'm not a scientist. I mean, we don't talk about me not being a scientist, but everybody's not a scientist. Everybody's not an epidemiologist or virologist. Everybody is not in that STEM space. But we can still be advocates. We can still be activists. We can still utilize our voices and our gifts and our talents, whatever they may be, to make progress and bring about change. And that's one of the main things we like to focus on at March for Science. So again, very, very excited to be here, and a super special shout out to Clayton Carroll II, who is actually an admin of both March for Science and Pantsuit Nation Supermajority, and essentially helped put this all together. He is the bridge that brought this beautiful, wonderful, amazing crew together. So thank you to Clayton.
Yeah, absolutely. I was going to show a pic of him, but I don't have one here. Look in the Pantsuit Nation group. He has a great post on getting the vaccine today. Please check it out. Clayton is really wonderful. So yeah, Grace, maybe talking about collaboration and intersectionality, maybe you could tell us why we're doing this special collaboration between our teams today.
Absolutely. The pandemic has really upended all of our lives, how we work, childcare, everything, and just school life in general. It just really threw us all, out of whack. And we have, since the beginning of the pandemic too, we've also been trying to sort through and deal with disinformation and misinformation from all sorts of levels, and not understanding what science is correct, what's not, and so this has also been culminating with the development of the vaccines, as well as with the approval process. We've just seen a massive rise in that disinformation. And so we know that this disinformation also really is targeted towards women and people of color. And with that, we also know, according to the US Department of Labor, that women do make up about 80% of the healthcare decisions in the United States. And it's because that women are these major decision makers, that having conversations with women and making sure that women and people of color have the correct and accurate information is so important. And that's one of the major things that we do at Supermajority Education Fund, is trying to provide resources and training and education around all of that. And with my own love of science, having a degree in science myself, and knowing that the vaccine is such a vital part of our overall recovery, in combating the pandemic, I really wanted to try and find a way that we can bring accurate and up-to-date information to all of our members at Pantsuit Nation and Supermajority Group, and basically equip them with having that knowledge to have conversations that they're already having with their friends and families and neighbors, in order to give them the correct information, in order to make decisions around the vaccines and to combat all of that disinformation and misinformation that we have.
Yeah, and you can see why this partnership makes so much sense, because it's such a big focus on March for Science's side of things too. And we do often talk about these conversations happening within families, within friend circles, colleague circles, within sort of your community, whatever that looks like, being so impactful. And the fact that we just can't take any of that for granted. And these conversations are so important, and vaccine hesitancy is understandable. And this whole notion that we're just gonna pretend like it's a ridiculous thing to be worried about the vaccination, and we're going to have some kind of like sugar-coated conversation, not really helpful, versus being able to authentically and transparently talk about what to expect, why it's important, etc., from trusted sources and people that you know and love. It's so powerful and so impactful. And Lucky has just done a phenomenal job bringing incredible guests on to talk, to combat the misinformation and disinformation, and also provide tangible, digestible pieces of information that everybody can go back into their communities and share. So yes, thank you so much for sharing those thoughts, Grace.
Yeah, absolutely. And to coincide with this takeover, we also have a special pledge that we're putting out, right, Grace? How can people get involved in that?
We do. So the pledge is a way that we are combining the information and expertise from all of you at March for Science with the storytelling really that's at the heart of the Pantsuit Nation Supermajority Group. And so we came up with this super informed, super engaged, super vaccinated pledge to let people know that they can go beyond today and commit to giving their friends, neighbors, and loved ones accurate information, uplifting them, and that they don't need to be an expert in order to do this, and in order for us to get to herd immunity and to a place where we can come to a greater sense of community and normal and be together again. And so we will try and drop the link into the live streams and things like that. It is a long link, but you can also sign that pledge at supermajority.com/PSN-SM- March-4-Science. We, like I said, we'll try and get that in the comment sections for that easy link, just so that people can continue to support and get informed and work to combat this disinformation that's so rampant and plays on the misogyny and medical racism that's in our communities and medical communities.
Thank you so much. And of course, we're going to culminate today's takeover with this show, where we're going to help answer all of your questions about the COVID vaccines. And thank you so much to the Pantsuit Nation community for submitting all your really thoughtful questions. And, please keep them coming in the chat below. We'll try to get around to as many as possible today. And, speaking of answering questions, we also have another special guest today. So I'd like to welcome Dr. Nicole Baldwin, who is a pediatrician and organizer with our partners at This Is Our Shot. Hi, Nicole. How's it going?
Hi. Great. Thanks for having me. I'm excited to be here.
Yeah, absolutely. Absolutely. And before we begin, could you please quickly tell the audience what the amazing work that This Is Our Shot is doing right now?
Yeah, absolutely. So This Is Our Shot is a grassroots organization. It was started by physicians with a goal of helping to engage and empower healthcare heroes and elevate the voices of healthcare heroes, just to help improve COVID vaccine confidence, COVID vaccine equity. And we're just so excited to partner with March for Science. And I'm super excited to be here with the Pantsuit Nation and Supermajority group as well.
So excited to have you all here. And yeah, let's get going with the questions. And for the regular viewers of the show, they'll know that usually I'm asking the questions and sort of channeling the audience stuff. So this time the shoe is on the other foot, so the pressure's not on. But I'm so glad Nicole is here to help us. So do you both want to start shooting us with questions?
Sure. So how long will the vaccine keep me relatively safe from infection or serious illness? I've heard it's been 3 months and 6 months, and this question comes from Karen Smith in our group.
Yeah, I can start on that one. So the quick answer is we don't know yet. I think there's a lot of misinformation. Recently, Pfizer and Moderna both came out and said their vaccine lasts at least 6 months. And that's the key, is at least. That's the amount of data that we have so far. It's probably going to be significantly longer than that. And just rest assured that they're studying that, and we're going to know well in advance if we need a booster. So we're just waiting for that data.
Thank you so much. And we're just going to keep barreling through. There's so many great questions. So this one, Teresa Gaines, and the question is, do you know if they're recommending yearly vaccines? If so, can you get a different manufacturer's vaccine?
I can do it again, I guess. Again, we don't know yet. I think that there are a lot of experts that think potentially we're going to need boosters. We just don't know when. And currently the recommendation is you stick with that same manufacturer. There's not a recommendation to change. I don't know if that'll, again, change in the future. So right now we want you sticking with that same manufacturer, and we'll let you know about boosters in the future.
All right. And our next question is from Clayton Carroll. And he says, one question I get from friends and family is how this vaccine is different from others. And people don't really understand why. So do you think you can explain it in a bit of a basic way?
All right, I can give this a shot, I guess. I guess we all know the brand names, right? AstraZeneca, Johnson & Johnson, Moderna, Pfizer. But what does that mean, right? So they all share a basic thing is that vaccines train your immune system to recognize a threat, but they do so in a safe training environment. So when you do come across a threat, then your body can handle it and knows how to respond much better. So the common part of all of these vaccines is they generate a small part of the virus called the spike protein that isn't dangerous by itself. It's really isolated from everything else, so you don't have to worry about it. But your immune system learns to see what it is so that when the whole thing comes and challenges your system, it can be ready. So I think the main difference, right, you've heard about mRNA vaccines and other vaccines, adenovirus-based vaccines, which are the two others in this case. So Moderna and Pfizer, the mRNA vaccines. So that's sort of the difference. They still have the commonality that they generate the spike protein. But the mRNA vaccines, they have a message, that messenger RNA is what they're called, that provides instructions for building that in your body. And whereas the other vaccines just have a different way of generating the spike protein. So you've got a modified harmless virus, which delivers the genetic instructions for that. So that is the main difference. And there are other differences which we are seeing both in terms of storage and in terms of what it means, when you get the vaccine, that we can talk about more in different questions. But that's the basics of how the vaccines are different. And of course, the mRNA vaccine is newer compared to the other ones, but it's not completely new. It's not like a year new. We've been studying it for decades and we've performed lots of trials in humans for decades. It's the first time it's being used on this scale, but yeah, we've studied it a lot. So hopefully that's a good start, and we can probably add things as we go along.
Well, actually, this very next question your answer segues into this next question a bit. Juliet Williams asks, how are the AstraZeneca and J&J vaccines different from Moderna and Pfizer? And does that difference have anything to do with blood clots?
You want me to do it or you want to do it, Lucky?
You can start and I'll add. I know this is a big topic this week, right? I think both of us should have a go at this. Yeah.
It's a hot topic. I've been spending a lot of time reading about this.
Me too.
First of all, the AstraZeneca and the J&J vaccine are a similar platform. They're an adenovirus vectored vaccine, meaning they take a virus called an adenovirus and they insert DNA that codes for the spike protein that Lucky was talking about. And that adenovirus helps that DNA get into our cells. Versus the mRNA vaccines, those are just a lipid particle, like a particle of kind of fatty stuff. And then the mRNA is inside of that, and that's what helps that get into our cells. So then the question comes, does that have anything to do with the blood clots? Well, so what they're seeing is these episodes of these rare cerebral clotting with low platelet counts. That's key. It's both of those combined. And that's happening in both the AstraZeneca vaccine recipients and the J&J vaccine recipients. Very low numbers. Keep in mind, very low numbers. But right now, scientists are working really hard to figure out, why this is happening and does it relate. Time will tell, but these types of reactions are not happening with the mRNA vaccines. And that's important for people to know because the mRNA vaccines are still in the US being given. So just know that those type of clots that we're looking at have not been seen with those.
Yeah. And the thing that I would add with that is that there was a lot of debate, let's say everywhere online, in the media about have they paused the vaccine? If it's only 1 in a million cases, should we pause everything for this? And I think it's a very complex decision and it's a hard decision for these authorities to make. But I think the upshot really is it's really science at work, and it shows how rigorous we are and what standards we have for making sure vaccines are safe. And it's something that we've always done, but not everyone has noticed when we've rolled out vaccines and different drugs, is that when we roll it out to the population, if we see something in the data that might look a little different, we pause it before it becomes a big thing, just in case. It doesn't mean that it's causing something. It's just how science works, right? It catches things early because it wants to make sure everyone is safe. So I think that's important. And I think the other thing is for, doctors like Nicole, I think it was important for the CDC and FDA because I think with the clots, they're different clots from the normal clots that you see. So the treatment is different. So it's important that doctors really got that message on how to treat it if they see it, in these rare cases, and to monitor the signs. So it's important to pause for that reason. So, we'll get an answer soon. They're pausing it for like another week at least right now. And so that's the main thing to know. Actually, I'm interested sorry, go, Nicole.
No, I was going to say the other thing I think is really important to add, you touched on a little bit, is that how this demonstrates how amazing our vaccine monitoring system is. The fact that they were able to pick up this safety signal with just 6 cases. I think I keep hearing a lot of people questioning that, like, oh, are there more than 6 cases? There's got to be more. There were 6 cases. Granted, they were looking for this because they knew what was going on with AstraZeneca, but that just demonstrates and makes me feel even better about our safety monitoring system, because they were able to, kind of say, hey, we need to take a breath. We need to just find out what's going on. We need to educate the physicians who are taking care of these patients. So I'm really impressed with our safety monitoring system.
Yeah, and we'll shoot through the other questions, but it's worth spending some time on this because it was such big news this week. And I guess the last thing I do want to add, and I want to hear from both of you actually, is that I do think it's definitely true that something like this, when you see it in the news, it's definitely going to cause probably maybe more people to be hesitant. But that might have happened if they didn't pause it anyway, and we heard about these cases. So I think that's important to understand. I think that's why what we're doing here right now is really important. We're having conversations. We're trying to really understand all of this complex stuff together. And the more conversations we have, it'll help. It's always best doing that than scientists should never hide data or anything like that. So I think this is really helpful. I'm interested in both of you, Grace and Rania. What did you sort of feel, or what was your instant reaction, like, honestly, when you heard that news that a vaccine was on pause?
I thought 2 things. That first, this shows that the monitoring systems are working, and that this was a good thing. As scary as it seems, it shows that science is working, and the systems we have in place to try and catch any bad side effects, they're doing its job. And then the other thing I had thought of is that just the birth control, the rates of blood clots with birth control is a lot higher, or seems to be a lot higher right now than with the vaccines. And just kind of it brings about another issue of women's equity and in healthcare, and the concern with the frequency with the vaccine itself versus what a lot of women are taking on a daily basis. And we're not seeing that same concern being taken care of in women's healthcare.
Yeah, and I think my first reaction, because I do feel like I have all kinds of things to say about the media, but I do feel like they did a really good job of really putting front and center that it was about 1 in a million, that it was 6 cases. And so I really internalized that first. And my first call was lucky because, of course, but then, but my first thought was, this feels very much like it's an abundance of caution, which is what we want. And I think, everybody's kind of said it at this point, but, we want that caution. We want to be absolutely sure and not take anything for granted. I also recognized immediately that I am not an expert, and I need to call people who are and ask questions of people who are, because I had these assumptions. The assumptions about, what was being reported as far as 6 cases and all of those things. But I wanted to have that confirmed. And yeah, so that was those are sort of my first thoughts. And then additional thoughts, was I did have a little bit of anxiety about additional hesitancy, understandably, just because it's a scary time in so many different ways, and so it just makes these conversations that much more important.
Absolutely.
And so continuing our conversation with the differences in the vaccines. And there is this question from Deborah, which I have heard before, if the Johnson & Johnson vaccine, if and when we start using it again, is 76% effective and the first Pfizer vaccine is 80% effective, do you really need that second dose, or are we okay to skip it?
You need the second dose. I'm going to jump in there with that because, again, that second dose is helping to give that boost to your immune system, to give that longer term immunity, and it's more effective, right? Why would you want to settle for 80% effectiveness if you can get 90 to 95%? I don't know. That's just my way I look at it. But no, it's important for the mRNA vaccines that are 2-dose vaccines that everybody get their second dose.
Yeah, and the thing that I would add to that was that we see these numbers in the media, and it's actually really hard to compare efficacy numbers, this magic number that you see. And one of the short reason for that is basically the trials were done under different conditions during different times. And so one of the big variables is the presence of variants, which we know sort of challenge the vaccine in our bodies a bit more. And so that's sort of why it's sort of hard to compare the numbers. I think the big news is, the thing that's most important is that they're all really great at preventing severe disease and hospitalization, and that's why we should feel confident getting whatever's best available to us.
And I just have to say, I'm not very good at math, but Nicole laid out that math really nicely, and even I can understand it. So let's not skip doses. I'll just throw that out there.
Exactly.
The next question comes from Lizzie. DiCamillo or DiCamillo, I apologize. I hate it when my name is mispronounced, and I might be doing it to you, so I'm sorry. But the question is, what is the progress on vaccine trials in younger kids?
Yeah, I'll definitely take that one. So it's really exciting. So far, currently Pfizer is the only vaccine that has some authorization for kids 16 and over, and they have submitted to the FDA for EUA extension for kids 12 to 15. So looks like hopefully soon, maybe in the next month and a half or so, month and a half, we might have an EUA for kids 12 and over, which is awesome. Moderna, it sounds like, is pretty close behind with their 12 to 18 group. And then both Pfizer and Moderna have started enrolling children in their trials 6 months to 11 years. Essentially, they're starting with some of that older cohort of kids and checking different dosages. That's really important because kids are not little adults, right? So we have to make sure that the dosages work for them and are safe for them. So once they find that dose, then they're going to start enrolling a bunch of kids. And we are hopeful, everybody fingers crossed, that we'll get some information and vaccines for those younger ones, hopefully late 2021, early 2022. And J&J, I know they are enrolling as well. It's mostly in the UK, I believe, and I think Brazil, and starting in the US here, I think. But I don't know what's happening with the pause. Sorry.
Thanks. That's so good to hear. I'm a mom of 3. My oldest is 7. They're back in school. This is like, let me get them the vaccines as soon as possible, please. So good news. Thank you for that. And our next question comes from Amanda. Are there risks that this vaccine could cause any problems in children in the future?
That is a great question. I think that is a question on a lot of parents' minds, right? We are all kind of wondering about, people are asking about long-term side effects. And what I can say is, in vaccines in general, if we extrapolate with vaccines in general, if we're looking at severe effects or effects from vaccines, they typically occur within the first 2 months after vaccination. And so we have that data. Do I have data 10 years out? Nope, I don't. And I'm not going to before we want you to vaccinate your kids. So there is going to have to be some level of trust. But the just overall likelihood is they're safe. It's unlikely they're going to have long-term effects in kids or adults for that matter. So.
Thank you. And this question is from Sharon. How can we discuss with someone who is not getting vaccinated because of fears of long-term effects?
Yeah, absolutely. I can say that, like, according to polls, actually, this is the number question of people who are not sure about getting the vaccine that gets asked over and over. And the first thing I want to say, totally understandable. As Nicole said, we can't show you the full data yet. So anything that where we don't have the full data yet, it's understandable to sort of worry a little bit, what is this going to do down the road? But I think what I would say with that, so first of all, we need to listen to anyone who shares those concerns and really address them. And what I would say from sort of my biology background is that in terms of, whilst we don't have a definitive answer for COVID vaccines, as Nicole says, most side effects that we know and we've seen from this vaccine and from the history of vaccines occur within the first 6 weeks, or they could occur early. It's rare that it will happen down the track with that. So that's important. And if it helps, from the science angle, particularly with something like mRNA, they break down really quickly in the body. That's sort of, they're designed to do that biologically. It's sort of an inbuilt system, right? And so your body sees the mRNA, it breaks down, it has a period of producing proteins, the spike protein, then it breaks down and it's cleared. And so that's why fundamentally it's sort of hard to see side effects linger and go on, because the vaccines are designed in that way. Nicole probably has a few more tips as well.
Well, I mean, I think you hit the nail on the head, Lucky, exactly with that. I think we have to be honest with people. I think we have to be empathetic with their feelings and understanding. But it's just that knowing, looking at other vaccines, we do have the data over now 6 months out with the mRNA vaccines and haven't seen any big side effects. So.
Thank you. Our next question comes from Laurel. What can you say to someone who is refusing the vaccine, contending that the vaccine was rushed?
You want to do that one, Lucky, or you want me to?
I can give that a start. Yeah, I think it's true that the vaccine was sort of produced quickly, but in a good way, in a way that science comes together and policy comes together, because we're trying to solve this horrible global crisis, that we come together and we solve a problem really quickly. I think it's a great example of when science and policy come together and work. And there are a few reasons why, we were able to put this together quickly, both from the scientific and infrastructure point of view. One is that, first of all, this coronavirus is very similar to previous coronaviruses that we've seen. So there's certain properties of the coronavirus, like the spike protein. We knew what that was and how that works before. So we just had to apply similar knowledge to, this new coronavirus. So we had a head start. So it wasn't completely out the blue. We had some prior knowledge. And in terms of the mRNA vaccines, again, like I said before, it was researched for over a decade and tested in humans in different contexts. So that's something that we know is safe and has been tested before, just now applied on a wider scale. And, the other thing I think that is really limiting for a lot of vaccine and drug development is that it's hard to get people to enroll in clinical trials sometimes. You got no problem when this is the thing that's affecting all the world. So many people rush to sign up and get involved in this. And the more data we have, the better science that we can do. I think that was a big step. And then again, in terms of the global emergency, the non-science parts really came together to make it happen quick. So building infrastructure to manufacture the vaccine was one thing. Another was prioritizing the review of the vaccines. That happened quickly. It was prioritized within all of those bodies. So a lot of things came together, which is why we have these amazing vaccines that have been very thoroughly tested in this time frame.
Yeah, I think I would like to add to that too. I think while the vaccines were produced quickly, steps were not skipped. I think that's what's important for people to understand. And the other thing that you didn't mention, Lucky, too, was the funding, right? So the funding piece was taken out essentially. So many times with vaccine developers, they're doing a phase 1 trial and then they have to wait and apply for funding and wait till that data is looked at to get that funding to do the phase 2. And then same thing. But with these vaccines, that was taken out the window. They went from phase 1 to phase 2, phase 3, and they were producing vaccines before they even had that phase 3 final data. So that if, and that was a risk, right? Because if the vaccines were not safe or were not effective, they were out, millions of doses or hundreds of thousands of doses, at least in the beginning of that vaccine. But it just ended up, everything fell into place. And that is just a testament to how great science can work when we all work together, right?
Yeah.
Such a great point. Next question is from Jennifer. What side effects have been seen in people with autoimmune disease, particularly in younger people?
So I haven't seen any data specifically for people with autoimmune diseases in terms of worsening side effects or anything. I think certainly we are concerned if someone is on a medicine that is suppressing their immune system, that they might not form as robust of an antibody response. And it's always important for them to chat with their physician who is managing their autoimmune condition. But there's not any contraindications for people with autoimmune diseases with any of these vaccines that I'm aware of.
And I think that you can tell me this, Nicole. I think the recommendations from a lot of health bodies are that basically the benefits of the vaccine and, the consequences of getting COVID far outweigh the small chance of getting side effects with this vaccine. And so they've recommended falling on that side, right?
Right, absolutely. And I think the other thing that's important to know is that illnesses or viruses also cause autoimmune conditions to worsen. And so it's important that we're protecting everyone from the virus. So, yeah.
Such an important point. Our next question comes from Elizabeth Groves. I'm high risk for anaphylactics. Is there one brand that's better than the other for reducing this risk?
So that's an interesting question. And I think that for Elizabeth, we'd have to know kind of what does that mean? You're high risk for anaphylaxis, because some people might have anaphylaxis to certain things like foods or maybe a bee sting or something like that. That does not predispose you to anaphylaxis from these vaccines. And I think that's important for people to know. I think that if we were doing this 5 days ago, I would say the cases of anaphylaxis have been lower in the Johnson & Johnson vaccine and not as, we're seeing more cases in the mRNA vaccines. But right now, I think whatever vaccine you can get in your arm, as long as you've not had a reaction or anaphylaxis to any components that are in the vaccines. And those components, you can Google them. They're on the manufacturer's website. That is the biggest contraindication for that.
Thank you. Next question is from Arlene. Can vaccination cause sterility?
No. The short answer is no. The long answer is
we're gonna bang right through them.
I was gonna say I do want to explain that a little bit. There was some misinformation that circulated very early on when the vaccines were released about that the spike protein, they thought it might mimic a protein in the placenta simply because it shared a couple little tiny pieces. That is not the case. I think the other thing, if people are asking you about this, how can you communicate this with them? It's important to have them think logically. So we're forming antibodies to the spike protein when we get the vaccine, and we're also forming antibodies to the spike protein when we get COVID. And so if there was a reason that it was causing sterility or causing miscarriage or anything like that, we would be seeing that in people who are getting COVID as well. And we're not seeing that. And we're not seeing these any safety signals in pregnant women that have gotten these vaccines. So no, I would not be concerned about that. And my own daughter, who's 17, was in the trial and has gotten the vaccines. And I am confident if she chooses, I will have grandchildren someday. So
that's awesome. And I think an important thing to sort of speak about from sort of the conversational point of view, and like as an immigrant particularly, I think there has been a very painful history of sterilizations performed without consent in immigrants and communities of color. And so that's why I feel really passionate about these things, because I think anti-vaxxers often attack those wedges and exploit them. And it's why we have to learn about like the truth behind these things and have those conversations with our community. So I think that's a really great question.
Mm-hmm.
That's a very excellent point there, Lucky, on that. And our next question is from Natalie Jones. Do we know yet if vaccinated people can still spread the virus to unvaccinated people?
So this is the one with more science, right?
Yeah,
Go,
I was
Nicole.
going to say, no, you can go ahead, Lucky, if you want to do it.
Yeah, so yeah, we're still studying that, but that doesn't mean a no. It's most likely the case that it's going to play a huge role in preventing transmission and slowing down this pandemic. And we've seen early data which seems to point to that good news in the countries where the vaccine rollout, including the US, is a bit more advanced and coming along. So something like 70 to 90% effective. I've seen the numbers. It's important to say that no vaccine is really 100% effective, which is why you hear about, why do I have to wear a mask and why do I still have to take precautions after getting the vaccine? And it's not that the vaccine isn't effective per se or doesn't work. It's just that when we're dealing with such a historic situation where there are so many cases everywhere, everything increases risk. And so we want to limit the risk. So even 90% effective is great, but you don't want to be that one person who is unvaccinated and might get it from someone who's vaccinated if that's a possibility, right? And so every life counts and we need to keep working to help each other get through this, you know? So don't give up first. The light is at the end of the tunnel, but we should keep persisting for now.
Yeah. The science is coming.
Yep.
And Beth Holmberg asks, what behaviors or activities are safe for vaccinated folks? What has some risk? What is still quite risky?
So that is an amazing question. I get that all the time. And again, that's changing as we learn more and know more too. I think that I like to say, and I have a friend who likes to say, the vaccines protect the vaccinated. So when we look at having a vaccinated person with another vaccinated person, I think that's a fairly safe environment. If you're in your own home, or even better outside, that has pretty low risk. Now, if you're vaccinated and you're with maybe one other unvaccinated person, that is a low risk individual. They don't have any high risk medical conditions. That is kind of got a little bit of risk to it, right? Like we just talked about, but still lower risk than two unvaccinated people being together. Certainly, I think I'm not ready to say that people who are vaccinated can go and sit inside at restaurants and things like that, because that definitely, especially if community rates are high, holds a little bit more risk. So again, I think everyone has to judge their own community rate and their risk in their family and stuff like that. But if you have vaccinated friends, please hang out together, and you can hug your vaccinated friends. I'm straight up, I'm saying it. You can hug your grandma. If you're vaccinated and grandma's vaccinated, go give grandma a hug.
Hugs to all the vaccinated people. We've missed all of them. Diane says, is there any indication that children younger than 12 years old are more susceptible to the virus or its variants?
So variants, we're starting to see that. So the B.1.1.7 variant, which is the variant everyone calls the UK variant, tends to be a little bit more contagious and transmissible. And we are seeing more cases in kids. That's not necessarily translating to more severity. So I just want people to understand that. It doesn't mean kids are going to get sicker, but more cases in kids, kids, it's not completely a benign illness. They can get things like this MIS-C, and they can, unfortunately, there have been almost 300 children that have died of COVID in the past year. So I think more cases is going to potentially equal seeing more numbers of that. But which is, again, why we want to get these vaccines out to kids, and we want to keep our kids still in masks and keeping them as safe as possible.
Thank you. Next question is from Gail. What do we know about how well the vaccine will work against the new variants?
So the good news is they work against the new variants so far that we've seen, even though the new variants are more transmissible and we are worried about them, particularly because much of the world, not to mention America alone, but the world is unvaccinated right now. And so that's why there's a lot of worry about variants. But from what we've seen for the data so far is that they work well, particularly again in the metric that really counts is preventing hospitalization and severe illness. You know, you might see things saying there's reduced efficacy, but as we say, that's sort of a different measure, and that might be true, but it's still overall very effective. So that's what we need to know. But I think the other part of that we need to understand is that yeah, mutations definitely happen, but from a public policy point of view, this is why we have to, help the world get vaccinated. It's not just about us, because the more you leave the virus out there, the more it can get mutated. And maybe we'll get unlucky and get a variant that is, avoids the vaccine. We don't want that to happen. So we really are all in this together, which is why we have to help the world get vaccinated and make sure when appropriate that we push for public health measures. So in places where you can't get the vaccine rolled out, which includes the United States right now, because it's going to take some time to roll out, is that, we try to slow down reopenings and, it's a hard balance, but we really need to make sure we're doing everything we can to keep the case numbers down.
Thank you. We have another question from Kate or Katie. What do we know about the vaccine for pregnant and breastfeeding women?
So we're learning more and more all the time about this. Unfortunately, pregnant and breastfeeding women were not included in the initial vaccine trials, but they were not excluded from being able to get the vaccine, which is good. And there have been tens of thousands of pregnant women who have gotten the vaccine so far. And so far, there are no increased safety signals, meaning no increase in things like miscarriage or preterm birth and stuff like that. So currently, the American College of Obstetrics and Gynecology and several of the other governing bodies are obviously recommending that women speak with their healthcare provider, but they believe safe for them to get this vaccine. The other really cool thing that we're finding is that there is some transfer of antibodies to the baby through the placenta. And so we may find this is why we give some other vaccines during pregnancy. We give flu vaccines and tetanus vaccines to help give that baby some antibodies. So you may really be protecting your little newborn if you get the vaccine during pregnancy. And then lactation, again, not any safety concerns. And actually, mothers can pass some antibodies as well through the breast milk to their infants. So I think definitely so far they look safe.
That's such great news. And a reminder that information is coming quickly. It wasn't that long ago that we didn't have that information yet. So it's very exciting to both of your points, just how scientists are working together to get these answers as quickly as possible. Next question is from Dorothy. Are there benefits of the vaccine for long hauler patients?
I can take that too. We don't know that totally yet. There are some reports coming out, and again, a report is not a study, but some reports coming out of people who have had these kind of what they're calling long COVID symptoms and got the vaccine and their symptoms resolved. And so that's a very intriguing point that people need to study a little bit more, but there's certainly not a reason if you've had COVID, there's not a reason to not get the vaccine, right? You can still get the vaccine, and maybe if you have long symptoms, it'll help.
Yeah, absolutely. And I one thing I do want to sort of visibilize is that I have been a little bit frustrated that I understand there's a lot of focus in the media on hospitalizations and deaths, because from public health point of view, trying to flatten the curve, right? That's important. But my heart goes out to everyone who's dealing with long haul symptoms, because I think that's often ignored. Like there's an assumption that you get the virus and if you're not hospitalized, you're fine, you recover. And that's not really the case. And so I really hope that, if you have people like that in your life, speak to them, provide them with support, and really advocate for more research and support for long haulers. I think that's really important.
Absolutely. I think they're left out of the discussion a lot, and it's so easy to jump to hospitalizations and death, but not really think of the long-term ramifications of having a disease, and the lifelong consequences of that. So definitely. And our final question, I believe, is actually from myself. Sneaking it in here. Do you have any tips or tricks on how to talk to friends or family or other people that we may interact with, who may be on the fence or hesitant about getting a COVID-19 vaccine? What can we try and do to persuade them, or any tips on that one?
Yeah, I think we can both do this one. I'll start, but I'm interested to hear what Lucky has to say too. I think the most important thing is being empathetic to anybody who is having questions or concerns, because again, all of this is new and it is coming at us very quickly. So it's important to not just shoot someone down. You want to say, engage them, ask them, what questions do you have? How can I help answer your questions? And the other thing is that this isn't typically a one-time conversation. It's not often, I think, that we're gonna just convince everybody in a one-time conversation. I think it's important to continue to ask those questions and talk to your friends and engage them in answering their questions.
I think you hit the nail right on the head. I think those things, listening, empathy, I think particularly from my community, my community is the science communication community. And sometimes we think it's about being on TV, being that next Bill Nye and sort of being fun and explaining science well. But actually, they're really, when it comes to vaccines and health choices, they're slow, patient, empathetic conversations that happen over time. It's not just going to happen in one shot. You're going to reveal this magic fact out of the hat and then someone's going to change their mind. It's almost never like that. And all of my conversations take a while and they can be hard and very emotional. And it's really important to stick at it and be persistent and, listen to the other person. And I think a myth that I think people sort of get is that when we talk about vaccine hesitant, right, it's not anti-vaxxers necessary. I think they're a small part of that. It's the most people, in the polls say they're waiting to get the shot. They're waiting to see what happens. And as we said before, that's understandable because this is a new vaccine, that is based on lots of great research, but it's understandable when we see something new, we're not sure and we might want to wait and see, which is why another important piece of the puzzle that everyone is doing is yourself. When you go get vaccinated, tell people about your and post that selfie and say why you're getting it and tell them about your concerns and tell them that maybe you're worried about something, but I'm doing this in spite of that because, and really what we've seen is in the sort of polling that it's gone down from something like 60% who were waiting to get the vaccine down to something like half of that at the moment, 30. I think you'll have to look up the specific numbers, but that ratio is getting smaller and smaller because people are posting and telling about their stories, and it's about the people who you trust, right? This is our shot is about that because a lot of people trust healthcare providers, but it's also your family members, your grandmothers, the people at your community center. So the more we all have these conversations like today and we do this sort of thing, it's the more we can help all of our communities get protected.
Yeah, I need to echo what Lucky is saying, because please don't not have a conversation because you're not a scientist or you're not in medicine or whatever. Like, it is so important. We know that people are likely to be more confident when they see someone they know getting this vaccine or they talk to someone they know. So, I mean, figure out some of the resources you can direct them to if they have more specific questions, but don't be afraid to engage and talk to your friends and family.
Right.
And I just really,
should...
one more time, I know we talked about it. Just one quick thing. I just want to echo what Lucky also said about the empathy front, because there's not only an old history of inequity and the like in healthcare, but modern. I mean, there's modern times. There's examples of it so much. So that empathy and that ability to come to the table and have a conversation with some patience and understanding, I think goes a really, really long way. So I just wanted to say that one more time because it's worth repeating.
And actually, Grace, I do want to say that it's something that I think Pantsuit Nation is great at, these conversations and like the humans, the faces behind activism and social justice and these causes and these struggles that we're all going through. So I've really loved that about your community over the years. And so happy to be here today.
Thank you. And we're so thrilled to be here with you. And empathy and storytelling and having those personal stories we have found really does make a difference. And you never know who you can reach through those. And if it's just one person, that can make that trickle effect and move somebody else to then also inspire them to have a conversation with somebody and so on and so forth. So a simple act of posting on Facebook or, tweeting about it or having a conversation with your friend may then turn into an inspiration for them to move on and do the same thing. So, we really are all in this together. And the only way we can really come through this pandemic is to work together as a community so that we can physically be a community and in community again.
Absolutely. All right. Thank you so much, Pantsuit Nation, for all your wonderful, wonderful questions. I thought they were really great, and we really appreciated having this conversation with you. So, keep them going in Pantsuit Nation and March for Science with This Is Our Shot. Keep having those conversations everywhere. And before we go today, I would love to do a roundtable, go around and sort of remind everyone how we can all connect and take action. So maybe, Nicole, if we could start with you, how can people find and connect with This Is Our Shot and all the amazing work that you're doing?
Yeah, absolutely. So we are on lots of social media channels. You can find us on Facebook at This Is Our Shot 2021. We're on Instagram, Twitter at This Is Our Shot. And then we also have a TikTok. So check us out on TikTok. Yeah. This Is Our Shot 21 is our TikTok handle. And of course, you can check out our website too, which is thisisOurShot.info. There's a lot of great resources there, especially for healthcare heroes who are looking at ways to help improve their messaging and engagement. So definitely check us out.
For everyone who doesn't know, Nicole's an absolute TikTok star, and I think one of the first sort of doctors/healthcare workers to really do amazing things on that platform. So look her up on TikTok. You won't be disappointed. I'm sorry I couldn't show it today, but do look her up.
Thank you, Lucky. I appreciate that.
Yeah, absolutely. Absolutely. Grace, how can people join Pantsuit Nation and take the pledge and take action?
Sure. So you can find us on Facebook. We're a Facebook group. You can just do a search for groups, Pantsuit Nation, Supermajority. We will pop up. We're searchable. You will have to answer a couple of questions, screening questions. Please do that. You can mention this live stream if you want. And then we will let you in and you can see all of our wonderful stories that we have from all of our amazing members. You can take the pledge. We have it linked in several posts there. We can drop the link to the pledge again, and you could go to supermajority.com /PSN-SM-March-4-Science. You can also check out Supermajority at supermajority.com and join that community as well. So thank you so much for having us and joining with us today.
Yeah, absolutely. This was so great. So great. And for us at March for Science, today's takeover is sort of prequel to more big stuff for Earth Week, right, Rania? So can you tell us some of the exciting things that we have planned? How can people join in with our Earth Week activities?
Yes, absolutely. We have a fantastic schedule for everyone this Earth Week, and we're so excited about our lineup. Every day of the week, beginning on Sunday and concluding on Friday, we'll be highlighting the pillars of our movement: community engagement, justice, public health, climate, and democracy. Next Sunday, March for Science New York, an Earth Day initiative kicks off the week with panels on climate policy, environmental disaster, climate communication, tech solutions, and individual actions that help bring about the systemic change that we so desperately need. And we'll be joined with guests such as Joseph Gordon-Levitt, cast members from Hamilton, former UN climate chief for the Paris Agreement, Christina Figueres, Nobel Peace Prize nominee Lois Gibbs, and many others. So make sure to register at the link in the chat. It's going to be amazing.
And on Monday, bear with us, we're going to get through this. We have a lot of stuff planned, which is a good thing. You'll enter the virtual festival to meet scientists, activists, and organizations doing the work and find out how you can get involved. Watch science demos from the World Science Festival. Check out virtual art exhibit. Learn DIY virtual reality and join a virtual march broadcast from a video game. And we're only scratching the surface.
And Tuesday, we're going to focus on justice. Please tune in. We're going to be joined by some incredible guests, including Tabu Nawasha, who's an activist and an artist from the Black Eyed Peas, Dr. Kate Marvel, who's a climate scientist at NASA. You can all tune in through the March for Science Facebook page and YouTube channel. Please follow us on our YouTube channel if you're not already, and on Facebook for that matter, which we're going to jump into the chat right now.
And on Wednesday, we're doing what we're doing today, public health. It's all about public health. We're organizing a special Let's Get Vaccinated forum where we'll be joined by experts and influencers who'll discuss the movement to end the pandemic. And of course, we'll answer more questions about vaccines and the state of the pandemic. But we'll also talk about how all of us, scientists and advocates alike, can do our part and make a difference in our communities. We're thrilled to be joined by epidemiologist Dr. El Said, who's an absolute rock star, doing amazing work in Michigan at the moment, and artist and activist Michael Stipe, who is an actual rock star.
And on Thursday, Earth Day, our focus is going to be climate in partnership with Youngo, which is the official youth constituency of the United Nations. We're going to be highlighting youth climate leaders from around the world who are spearheading climate action. They're so amazing, I have to tell you. And not only are we honored to feature all 7 of the UN Secretary General's youth advisors representing every major region of the world, but we also have the privilege of being joined by the Secretary General himself.
And to close out Earth Week, Friday will be all about democracy because we love democracy. We'll have some high-level conversations with the champions of democracy like Mark Elias, one of the most prominent voting rights lawyers in the country. But we'll also be highlighting March for Science chapters from all around the world because our movement is global and we're excited to learn about what our international compatriots are doing and fighting for. And of course, how can we all support them and one another? And with that, we are at the end of our show. So thank you, everyone out there, Pantsuit Nation. This is our shop, People March for Science community, for joining today. Don't forget to subscribe to our YouTube channel to keep participating in this community. And remember, boosters, facts save lives. Stay safe, everyone. And thank you, Grace, Rania, and Nicole, for joining us today. We'll see you all next week. Bye, everyone.
Bye.